All right, I was just doing a case review with an awesome patient. This is Alexandra. Tell me, when you first came in, we've been working with you about 3 months now. What kind of problems were you having?
I was constantly tired. I was very moody, and I was having heat flashes at night, just not sleeping properly, exhaustion.
So we did some exam. First thing I did a complete metabolic profile on you. And the first thing we noticed is you also had a symptom of constantly having to urinate, remember?
Yes, every hour I had to go to the bathroom. It was ruining trips. I couldn't sit in traffic. It was pretty bad.
It was pretty severe. So when I did your blood work, I also threw in, we did a urinalysis and we looked at chronic infections in the urinary tract and kidneys. And you had a serious infection there that had been ongoing for about 1.5 years. So we started working on that, didn't we?
We did, because all the doctors kept telling me I was fine, and they would put me on antibiotics, and it would just kept coming back. So after seeing 3-4 doctors, I gave up for 1.5 years until I came here. And see, now I even forgot that I had it.
Yeah, exactly, because I was really on that one.
Yeah.
So you had some foot pain and you were irritable. We also, when we did some tests on you, we also noticed that you were having some reactive hypoglycemic swings.
Oh, yes.
So we did some therapies nutritionally, and we worked on some infections. And one of the first things I did, I started supporting sugar regulation with you. So in addition to working on other infections in the tissues we were in, we worked on sugar regulation. And you really liked having your sugar balanced out, didn't you?
Yes, and so did my husband.
little easier to get along with. People don't realize when they have those mixed patterns of things, what's really going on. And we definitely get irritable, especially with hypoglycemic episodes.
Well, right when I'd come home from work is when it would hit. So I'd come home and be super moody, and I couldn't think, and I couldn't function to the point where I couldn't feed myself, which was going to make me feel better. And even at work, I would have moments where I couldn't remember things, and I just was very flustered.
Yes, yeah, and you know, that's the thing when we start working with people like that. I know if we can give you some energy, take the stress off the system. The brain does not like to be out of fuel. And so people get real reactionary and they don't really know how to pinpoint it on things. So we did some post labs on you and we just reviewed them, and you've done excellent. You have a couple of things I want to fine tune with you. You're a real pleasure to take care of. You're a wonderful person. Would you mind if I share this with other people?
Go for it.
Awesome. We'll see you. Thank you so much.
Thank you.